Hello, everyone, and thank you very much for joining us. We are excited to present today's broadcast on reopening and operating safely. This broadcast is presented as part of the Topo.ai educational webcast series. In light of recent surges in COVID-19 infections in different parts of the country, we sincerely hope today's discussion will provide timely guidance to organizations of all sizes. My name is Andrew Saluk, and I am your host and moderator for today's discussion. My company, Topo.ai, provides best-in-class command center software. We integrate location-based risk intelligence alongside company locations, personnel, and assets. This provides one common operating picture with all of the alerts and alarms, extreme weather events, and subscription and open source intelligence in one place. We make that information customizable, actionable, and measurable for security teams, and we call our product Topo One Software. I'd like to introduce our panelists who bring federal law enforcement and private sector experience to today's discussion. The Chertoff Group is a global advisory services firm that applies security expertise, technology insights, and policy intelligence to help clients build resilient organizations, gain competitive advantage, and accelerate growth. They offer a unique and extraordinary blend of government and private sector experience to their clients, and we are fortunate to have Jay Ahern with us today, who leads the Strategic Advisory Services team. Thank you for joining us, Jay.
Thank you. Great to be here. Thank you, Andrew.
You're welcome. And I'm sure the audience is very familiar with the National Football League and its many contributions to our Sundays. The NFL also provides career opportunities and economic support to many communities and charities. The security department is led by Chief Kathy Lanier, and she has assembled a world-class group of security professionals, one of whom is with us today. It's my pleasure to welcome Rob Gummer, who leads the NFL's intelligence operations. Welcome, Rob.
Yeah, good afternoon, everyone. I'm glad to be here.
Let's cover a few quick housekeeping items. If you get disconnected for some reason, please rejoin using the same link you used originally to log in. This webcast is being recorded, and we'll send a link to the recording and presentation slides later this week. Your microphone is muted. Submit questions at any time using the Q&A button, which is part of your navigation panel. We will ask a few polling questions throughout the broadcast, but we will not share your identity with the audience or attribute any questions or responses to you as an individual. We just want to facilitate candid questions and feedback on this webcast. Here's a quick look at our agenda. We'll cover as many topics as we can, reserving time at the end for a live question and answer session. For each of today's topics, we've included links to some supplemental resources in case they're helpful to anyone in the audience. And we will include these resources when we send the presentation slides later this week. Let's begin our discussion. So when we started planning this broadcast weeks back, both Jay and Rob emphasized how the dynamic nature of the pandemic necessitated an adaptable reopening strategy. And since then, we've begun reopening. We've seen cases spike in many locations, to the point that some governors are delaying their reopening plans, and you may have seen that California just closed a variety of businesses across the state. So for organizations who deal with large numbers of customers or who can't simply work from home indefinitely, can you describe the key components of any reopening strategy? And does your advice change for businesses who rely heavily on in-person customer interactions? And Jay, perhaps you could please address this one first.
Yeah, I'd be happy to, Andrew. I think one of the key things that people need to realize, and I think this has been a challenge for government at the federal level and certainly down to the state and the local and the county level. This is not a one-size-fits-all response, and therefore it's not a one-size-fits-all strategy, or therefore the components that go into a strategy. Geography plays a big part of this. The social statistics of individuals who live in an area are key to that. And certainly businesses, the type of businesses people are in, whether they're actually in the sporting industries or whether they're in the event management or whether they're in retail or whether they're in providing services. It's all unique to the individual business. And I think that's been certainly one of the challenges, particularly at the governor level, that they've had a challenge trying to go ahead and make statewide decisions as opposed to really taking a look more uniquely down to the more local level. I think critical in any type of a strategy is you got to have one. And I think that's oftentimes been one of the things we've seen over the last 3 or 4 months, that many entities did not have a strategy for dealing with a pandemic. There certainly was resiliency of operations for supply chain disruption, or perhaps for a man-made or natural disaster or an active shooter event. But I think one of the things that really has caught people off is, how to deal with the pandemic. Not many that we've actually encountered had a very detailed plan for dealing with a pandemic. And I think one of the things too that folks often, have seen as a challenge is, how do you respond to something like this? Unlike when we saw a lot of the man-made disasters or natural disasters that we saw over our time in government, whether it be hurricanes or whether it be active terror, those are very isolated in a very specific area. So you could actually marshal resources in a response to a particular area. You haven't been able to do that effectively in this particular event because it's happened across the entire country. As we saw things surge initially in New York, New Jersey, then we started to see other states start to go ahead and be impacted. Now you're seeing Florida, California, and Texas at the top of the list. Being able to move resources where they're needed as far as having a recovery of operations or even sustainment of operations, that has been a challenge. But I think having a key element of a plan has been critically important that a lot of companies don't have. Having a resiliency plan for making sure that companies are able to go ahead and be resilient throughout an operation so they didn't have to start shutting down and then looking to restart has been a challenge for many. One of the things I think that has really brought into light too is supply chains. Supply chains over the last several years has become much more for manufacturing companies, just in time, trying to limit storage, overhead, and time because that equated to money. But now supply chains are just disrupted depending on where things originate. And being able to get equipment to continue to run manufacturing operations or to be able to supply venues for events when they are able to go ahead and reconstitute themselves, those have been essential. But it even attracts and impacts attention on other areas such as business travel. How do companies continue to impact their business going forward? Travel for executives to go ahead and have face-to-face meetings, where it's a global company or a sales meeting. And certainly other challenges for companies that are involved with sponsoring events. And I know we'll talk more about that going forward. But the last comment I would make, Andrew, is that one of the biggest challenges that people have realized is, the cyber component. It's often overlooked until something negative happens. But as we've had more endpoints put out there through remote teleworking, that has created a vulnerability, and many cyber bad actors have taken full advantage of that. So let me pause there and throw it back over to you, Rob.
I appreciate that, Jay. And I heard you talk about things such as organizations not having a plan, or perhaps not having a stable supply chain, or relying on a just-in-time inventory model. You also mentioned business travel and cyber have both been disrupted. So Rob, what's your take on the key components for a business that needs a reopening strategy, and just any thoughts for people or businesses rather, that rely heavily on in-person customer interactions?
Thanks for it, Andrew. Well, it's interesting, kind of jumping off the point that was just made by Jay. I think this situation has definitely tested business continuity plans across the board. I know initially, even at the league level, we had planned for maybe a 3 to 5 day contingency. You had to shut down operations and then look to reconstitute those operations. But then we were placed into an environment in which employees are working from home, you had to shut down your facilities, and upwards of 13 to 14 weeks, and then make a reopening, return to work, return to play strategy that makes sense, that protects employees, and then allows you to maintain the resiliency of your business model as best as you can. So when I was thinking about this last night, I came up with an acronym just because I'm a former military guy, former government guy. Sometimes acronyms makes it a little bit easy to think about key foundational components, which I think are important in any of these plans. So bear with me now, but the acronym I came up with was SERIOUS, like SERIOUS. And the components of that are: your plan has to be safe, it has to be effective, it has to be repeatable. But the last four are ones that I want to expound upon just a little bit. For the I, inclusive. So one thing that's been learned throughout this time period is the fact that oftentimes business entities will make a strategy or a business continuity plan that only affects their department and the things that they currently have direct ownership over. What I'm talking about inclusive is that there's a lot of dependencies. So you talk about supply chain, you talk about all the other variables in that scenario. So you have to be inclusive of all the verticals, recognizing that is not just your business that's impacted, it's your partners. Like if you take the league, for instance, we have a variety of different third-party vendors who are intertwined into our ecosystem. So whatever plan you put in place has to be inclusive of that, to include things like building maintenance, facility, responses, what have you. The O has to be official, meaning that whatever plan that comes out, has to go across all leadership, and everyone has to agree that this is the strategy, and that leads right into the U in this, and that's uniform. Much like the bubbles that a lot of the other sports organizations are trying to establish, if you're rolling out a plan, particularly when you're dealing with infectious disease, it has to be uniform across the different business verticals. The moment that one group in that vertical decides to do something entirely different, it causes the rest of your plan to lose its credibility and its relevance. And then last but not least, and I want to make the distinction between repeatable and sustainable. The other thing that we've come to the realization of is that pandemic was not necessarily in a lot of folks' budget for the year. So COVID-19 and all the associated stuff with that wasn't part of the plan. So we were talking about sustainability, and you're thinking about return to work, or for us, return to play. Getting your hands on things such as PPE, which I know we're going to talk about a little bit later, like PPE, your testing protocols, what kind of vendors you bring in for things such as temperature testing. All of that has cost, and all of that has to be sustainable through the length of time in which your crisis is going on. And then you had to think about the second and third order effects, which is like the 3 months plan. Do we have enough for 3 months? Do we have enough for 6 months? Do we have enough if we go backwards like we're starting to see right now? All of that has to be part of the foundation of your plan. And if you put all those in motion, not saying that it's going to be 100% successful, but at least your business leaders will be thinking about the right things. So I'll give it back to you, Andrew.
I really appreciate that, Rob, and I'm sure that there were many on the broadcast furiously scribbling down the serious acronym. One of the things you both touched on, pandemic wasn't in the plan and then wasn't in the budget. And I'm just curious, as this pandemic has unfolded, has either of your perspective changed on what should be part of a pandemic plan, maybe based on your past experience with SARS or some other infectious disease? Let's start with Jay.
No, I think absolutely. And going back to some of us that were actually serving in the Bush administration prior, there was a plan. And a lot of the things that went into that plan was making sure that you actually did have plenty of PPE to be able to sustain, as Rob pointed out, for a long period of time, not just for a week or for a month. You needed to have sufficient supply to be able to protect your workforce, but also those that you're encountering. There was also looking at making sure that there was the capabilities for, is there a consideration for a vaccine? Obviously, that has been one of the most critical factors that people are still looking at today. Now, obviously, this is a new COVID-19 vaccine from what we had seen previously, but being able to hurry and hustle to make sure that there was capacity to go ahead and do the lab testing, get it rolled out to be able to treat the COVID-19 type of virus going forward. But also just the testing, and I know that's become a very, very considerable issue for a lot of companies, as well as people throughout the country and down to the state and local level, the capacity to go ahead and test people. And a lot of that's not necessarily based on people that are symptomatic. It's just kind of the hysteria that has been created throughout the country in many parts of this country and in different individuals. They're rushing to get a test when they may not be symptomatic and may not need one. And that has just overflowed the capacity of testing capabilities and of the testing companies. Hospital capacity certainly has become something that has been tested. That was considered also as far as early on in some of these planning metrics that were considered in the past. But again, these became things where when you take a look at risk and how do you actually take a look at defining risk, it certainly is, the equation of threat, vulnerability, and consequences. And when you take a look at the threat, is this really something that people had top of mind that would have the impacting it would happen on the country today, on every walk of life, on every type of business, on every state throughout our 50-state union? Did people realize the consequence of this? And you're seeing many people as individuals and many companies as entities being bankrupt as a result of this. So the consequences are great, but I think that's where I think the government made some mistakes in the planning part of this to make sure that they actually did go ahead and thoroughly consider all the different aspects of a plan and the right metrics in place to be able to forecast some of this that was happening and get ahead of it sooner than we did. Because again, sooner you can get in front of some of these issues, you can certainly go ahead and actually diminish the impact of this. Never eliminate that risk, but you certainly have an ability to go ahead and take a look at mitigating some of that going forward. But you got to have metrics, because again, this is something that I think that a lot of people, when you turn on your daily news or your news throughout the day or the evening, the numbers are always just given in the most alarming way by the people in the media. And, you know, they are accurate numbers, but it's all in how the numbers are portrayed. And learning a lot of lessons over time for over 30 years in government and 10 years since being out of government. Numbers tell a story, but don't tell the entire story. And you got to understand what the statistics mean and what that metric is trying to go ahead and give a leader a decision point to be able to follow up on. And I think that's one of the things that has been a challenge for the country at the national and the state and the local level, to really understand the impact of the numbers and how it will go ahead and impact their entity and their state. And the same thing for businesses. I think the businesses need to get a better understanding of what the metrics and what do they mean for you. But they're going to be different in every part of the country. Geography is going to play into this, certainly as far as, you know, the social statistics, age of individuals, pre-existing conditions, understanding your workforce. I know one of the last points I'll make is we've been doing an engagement for, you know, a Fortune 20 company. They want to actually do some predictive level of analysis to find out what's going to be the potential mortality rate for their workforce, so they can figure out what's going to be the loss of personnel in the workplace, and also what's going to be the financial impact and compensation that are going to be due some of those individuals or their surviving families, to try to be able to predict some of that based on the numbers we're seeing and the trend analysis being presented. So a lot of data that can be used to help companies better position and inform themselves going forward. And by no means is there an immediate end in sight. So I think that's something that companies and entities certainly can take advantage of going forward.
Well, Jay, thank you for that detailed information. And I think that's a fantastic segue into the next topic, which is and you've already named some of these different data sources or metrics you're looking at. So I'll address this question over to Rob. What are the different data and intelligence sources you recommend that organizations monitor or factor into their COVID reopening and operating plans? And Rob, I know that you and your colleagues in the GSOC have been studying this issue very closely.
Yes, Andrew. So the one thing that we found that was interesting, specifically in this environment, is unlike some situations where you're kind of trolling around for information, you're really trying to call through a variety of different data sources. There's almost too much information out there, which for decision makers can be quite confusing. And then eventually, it could be overwhelming, I guess, to be honest. And unfortunately, the rollout to address this became, and part of my analogy, a choose your own adventure book. And, you know, as a result, you had different levels of folks tracking information in different ways and different times. So what we had to do is kind of go back to the basics. So obviously your first place you should be checking is the CDC official websites. Without question, that gives you the most, the best information that you have at that current time that you can actually build a site and have as an effective source. From there, oftentimes those sites will give you leads to the state level sites. And then those will also point you in the direction of county and city level. I know for the league, to give you guys context, we have 31 different stadiums. We have facilities both domestically and globally. So it was quite a challenge and continues to be a challenge to not only keep track of the restrictions at the state level, but also specific restrictions at the county level, because different counties have implemented their own measures and PPE requirements. But then more specifically, in certain cases, I'll take Philadelphia, for example, you'll have a city that makes its own edict, or Chicago, who makes its own edict. And if you have equities there, it's going to be just as important for you to be dialed into that, for yourself, for your decision makers, and also for your employees. So I'm thankful in this space that we've been working hand in hand with Topo.ai to really try to vet, the best sources of information and be able to get that kind of understanding at a very nuanced level of what's going on across the bow, because I can tell you from my optic, we get questions on this all the time. We're currently in planning to start the season. There's a host of other dependencies, Super Bowl planning, event planning, and folks do want to travel. It's very hard for them to digest, a ton of this information. So what we've done is taken a lot of what we're seeing, say, on this dashboard and pared it down into an easy spreadsheet that breaks down by state, by city, gives the current guidance that's in place, is actually posted on our kind of SharePoint site, what we call Playbook. So every employee, every manager has that quick reference. And again, making sure that data that we're leveraging is backed, by a credible source, or as credible as you can find it, because everyone tracks it in different ways, and you'll find disparities in numbers. But by and large, you'll find commonalities on the hospitalization rates, on the rise in cases or the 14-day decline, and you really have to pare that down. And I would say the other suggestion is for those who really starting to dial in a space is to do a lot of benchmarking with your partners. Because there's a lot of information, there's a lot to digest, get those best practices and share it amongst each other as a group, because all of that does is really fine tune your decision points and the information that you're given to your employees in any situation.
Rob, I really appreciate that response. And you both have put a lot of thought into this issue, and it seems like you're approaching it from different perspectives. And in some case, the more important item might be protecting your workforce, and in some cases, you also have to consider the fans and the people who would attend these events. Both are very important, but they require different considerations. And so let's take a brief pause there and ask our first audience polling question. And we ask that you please respond in the polling window, which will appear momentarily. And let's just look at some of the challenges that different organizations are facing. So which of the following are significant challenges related to your COVID reopening or operating strategy? Please select all that apply. Select option A, our strategy seems incomplete or inflexible. Option B, it is challenging or time-consuming to track relevant information for different locations. C, insufficient government guidance or support. And D, there's simply too many unanswered questions with this pandemic. Thanks everybody for your responses. We'll go ahead and end the poll right there. And I'll share the results on screen there. It looked like the biggest challenge for everyone with this particular, for 63% of the audience with COVID-19, there are simply too many unanswered questions. So let's get on to our next topic then. We've seen many different protective measures recommended: plexiglass barriers, social distancing, or some capacity limitations, masks. Are there any others that either of you would recommend? And then what has been your experience obtaining these supplies? Jay, perhaps you could share your thoughts.
Yeah, when I consider this and see what many companies are doing, businesses are doing, and what's being contemplated going forward, I think one of the key things is, and it goes back to one of the earlier topics, Andrew, and that's having a plan. And how does this fit into the overall plan? Just putting plexiglass barriers or requiring people to socially distance, wearing the mask, things of that nature. Those are very fundamental things that are just good health practices that are being recommended during this time. But I think one of the things too that oftentimes when people start introducing new commodities or new technology into a concept of operations is they don't have necessarily a full and well thought out concept. They don't have response protocols in place. And how do you deal with the one-off sets of circumstance? And I'm sure, Rob, these are some of the things you're dealing with in the NFL and how to deal with those things that are not within the norm. Because as you introduce additional things that, the government is thinking for air travel, potentially thermal cameras to look for individuals with fevers boarding a plane, looking for asymptomatic cases that actually would only be identified through, a temperature check, and be able to have high throughput and high capacity, being able to go ahead and deal with that, so you're not going to impact a boarding process or TSA checkpoint. Having that well thought out concept is going to be important, but also, what do you do with something that comes out to be, a nuisance alarm, a false positive, a failure alarm, and how do you deal with those individuals that may have a legitimate access to come to work, go to an event, or come into a place of business that don't present any risk? And how do you go ahead and then communicate that plan? And I think that's another part that is one of the most important elements of this whole challenge that we're dealing with as a country and as a society, is a strong communication plan. And that includes, the signage, having clear written policy, so that people don't think they're being singled out or being biased in any way, and that we're actually trying to do the most thoughtful thing we can for businesses and individuals in the safest and most efficient way possible. However, you're dealing with human behavior, and I think that's going to be one of the biggest challenges until there actually is a vaccine later in this year or early in next year, to be able to go ahead and deal with this challenge that we're facing, because human behavior is one of the most unique things I think we'll all deal in our lifetime. And changing the human behavior, you're going to have people that are going to go to the extreme. They're going to want to go ahead and just self-isolate and not go out, even though they don't present any concerns. That's going to be impact for business, and certainly for restaurants and for venues and for other types of industries. Then you're going to have people that are going to go to the extreme and say, I'm young, I'm healthy, I have no problem. And they're going to potentially be a spreader because they don't follow some of the fundamental challenges. So I think one of the biggest things that I think, beyond just the fundamentals of putting out hand washing, sanitizing, distancing, masks, plexiglass, things of that nature, and technology, is how do you deal with the human aspect of this? And this is something that you cannot over communicate enough on, internally within a company, and also to anybody that you serve if you're a publicly facing entity.
Thank you very much, Jay. And Rob, I know this is a bit more challenging if you've got a space like a stadium, but what types of protective measures might you recommend? And then what has been your experience with trying to get them?
Well, first, I will address the PPE issue. So when our organization was trying to acquire PPE, say back in March or April, it was quite costly. And on top of that, you had this very strange situation where you had companies more or less bidding against each other to try to get resources. Now, I will say now that, masks and gloves and, the right cleaners and stuff are more readily available, that's improved that situation. But if you try to put that same situation onto, say, stadiums or whatnot, it gets even more complex because, kind of what I said before, a lot of these folks, didn't have this as part of their budget plans, and then that's not even factoring staffing or whatnot. So when I look at the situation at large, oftentimes, in the security environment, we're trying to control as much as possible, factoring in the variables. So when I think about our return to work strategies and return to play, there's always like what we do know, what we can fill with technology or processes or personnel, and then really thinking about those, constantly thinking about your gaps that come out of that, recognizing that not all technology is going to solve the solution. Not all processes or people are the solution. It's confluence of all those things together that's going to get you at least an 80% solution. But similar to what you saw in the poll, there's a lot of stuff that we still don't know about the virus. There's a lot that you don't necessarily have to control over, as a business, So the things you do control, though, are the activities that go on within your space, as much as possible. So, whatever your initial plan has to be, has to try to factor in as many variables as possible. So if I were to take the league, for example, within the workspace, we've designated incident response teams and infection control officers in the event that you have, say, an employee who decides like they get inside the space and they don't want to wear a mask. Or if someone does test positive inside that space, those individuals will be responsible for coordinating that response. Factoring in the fact that any of that information, is governed by HIPAA. So it isn't like you're putting on blast and it's on a blast email like, hey, employee X, tested positive for COVID-19. But you have to have very clear processes, ways to report, be able to store that data, to be able to track that data. Then how do you embed your security department and to assist in those matters? All of those are complex plans and strategies, but can be done well with clear communication. And clear communication really goes throughout the entirety of your plan, specifically when you're naming infection control officers and incident response teams. It can't be just designating them on paper. From there, you really have to make sure those folks are properly trained, not just on the roles and responsibilities, but the expected response in the event that something occurs. And it has to be mapped out with as many different potential scenarios as possible, and you have to be comfortable with that. And to pull an old adage from the military, it's kind of the train as you fight model. You have to test that continuously. I think one of the holes in the game, I know even from my own experience, is that folks would have business continuity plans, but they wouldn't put a lot of stock in them. Like, that's something that might happen, but not really. And because a lot of those weren't tested, some of those plans had fallacies or had just some assumptions that turned out not to be true. And therefore, when those plans were executed, a lot of the steps started falling apart. And therefore, the things that should have already been teed up, like having monies on the side for additional PPE, having storage of PPE together, your ICO knowing exactly what they're supposed to be doing, your incident response team knowing exactly what their role is, and then having some designated technologies that are up there to fill some of those holes, just weren't there. So as we are thinking about our plan now, we really have to factor in some of the assumptions and biases too, and understanding that a lot of the technology that's out there is still unproven. So like if you take temperature screening, for instance, unfortunately, temperature screening only works, when someone who's asymptomatic starts showing the fever side of the virus, but they could have had it for a number of days prior to that. So in my opinion, when you're looking at your strategies, it has to be multi-tiered, but at the same time collapsible, because some of your assumptions and fallacies are, and based on information you have a certain period of time, could change the better educated we are on the virus and how things transmit, but also on the impact on the workplace and whatever your current environment is.
Thank you very much, Rob. And let's go ahead and move on to our next topic here. And we'll continue with Rob and then go back to Jay. And so performance and athletic venues, they obviously rely on live audiences for revenue. We've seen some comedy shows resume in some places. We've seen NASCAR races resume in some locations with socially distant audiences. Disney reopened one of its parks last week with social distancing measures and characters no longer interacting with guests in a face-to-face manner. Can you provide any additional guidance for events that have a live audience? And we'll start with Rob and then go back to Jay.
Well, I'm sure to no one's surprise, that's on this call, it's something that we are constantly trying to work through now, because there's a lot of things you have to take into consideration. One, is obviously the safety of the fans who are wanting to attend the game. And how do you do that and ensure social distancing? How do you do that when it comes to even some simple things as vending, food vendors? How do you safely provide someone, that food service or drinks in a way that doesn't increase the risk of a spread? While at the same time recognizing that everyone in that space is taking a risk. You as the business owner, the moment folks step through those doors, you own whatever happens inside that space, but you also have to recognize that you have no idea where that individual was at prior to coming into your location. Additionally, we had to think about the safety of the players. And again, the more variables you introduce into an environment, the less control you have on whether or not those players stay protected. So if I were to make a comparison, we're keeping a close eye on the NBA, and the MLB, and the folks who are trying to establish a bubble of sorts, where the folks inside that bubble are just inside that bubble, and they're limiting kind of the outside contact. The more individuals you introduce into that environment, so say you have certain stadiums in which fans are allowed, and other stadiums which there's no fans, a environment, so to speak, could be more sanitized in the no fan environment, but then those teams travel, right? So once that team goes into a environment with fans, you have to be able to account for that increased risk. And maybe the way you account for that is that you don't have fans anywhere close to like the main sidelines like you would have right now, where you only fill the top portion of the stadium as far as capacity, that you don't have kind of like the VIP boxes that folks are used to. Again, it's so dynamic, and it's a risk no matter what, because if you go without fans, obviously you're thinking about the experience of football or any sports. It loses some of its luster, it loses some of its impact, and how folks experience it. But then you go with a certain amount of fans and certain whatnot, then you have the variable of certain cities feeling slighted, like, how come I can't go if they're doing it in California or in Texas? So it's a constant, risk calculus for us that is ongoing. And even when we come to a decision point, I think it's going to have to be based on all the local guidance. So for us as a league, it's super important that we're adhering to any of the state, local, or city guidance that they have in place. And we're not going to go outside those bounds. So if a certain city says, hey, no fans in the stadiums or any of our sporting events, then of course we're going to follow those policies and procedures. Again, ensuring the safety and security of all parties involved is paramount in our minds. But it's definitely going to be probably our greatest challenge throughout this year, and I would say even events forward post this pandemic.
Thank you very much, Rob. And that was a really thoughtful and kind of step-by-step breakdown of how you're thinking about the issues. And Jay, I'm just wondering if you had any additional guidance. I know that some of your colleagues did a fantastic resource with Eventbrite, with the safety playbook for events. Just curious if you had any other thoughts to add.
Yeah, I thought Rob gave a great summary of the different key elements, and I would just kind of accent a few of those and put them into some buckets. I think first off, you need to take a look at the venue, and I'll use the venue and describe that in the broadest of terms. So certainly for the NFL, it's a football stadium, locker rooms, the buses, the transportation to get people to and from, and where they stay while they're there. So those venues, they all need to be cleaned and to a point of decontamination. Same as you would if it was a theater in New York, or same if it's some type of an event that is being put on by a concert planner. You need to make sure that the venue itself has been cleaned with a deep cleaning and is decontaminated to the point so there's no existing virus that could then expose that first person or the first worker that walks into that facility. And that's a challenge. Then maintain that sterility over time. Then as you start to bring in the workers and the players, the performers, the athletes, how do you continue to make sure that the people who are coming into that venue are not infected or going to go ahead and add to the risk of people that are going to be there? So I think that's a key part going forward. How do you then also making sure that you secure that supply chain, making sure that the commodities that come in there, whether it be food for sporting events, whether it be, kegs of beer for our beloved sporting events that we like to go ahead and partake in when we're going to different sporting events, that it is wiped down and swiped cleanly enough to make sure that there's not anything that's riding in with some of that into a stadium that could again expose the participants or the players. Those are key parts going forward. But this is no real difference than a very smaller contained environment, like an aircraft cabin, making sure that the airline is cleaning that cabin, making sure they've got the right venues. But then also, how do you maintain that sterility when people are in there? I think the biggest challenge that the sporting leagues are going to have, different than perhaps those in schools or colleges or in the entertainment and other parts of the entertainment industry, is, the NBA is doing it in a bubble. MLB is trying to do it somewhat similarly, but not to the same extreme as the NBA is in Orlando. But how do you not create a competitive disadvantage for one over the other? Because obviously, there's so much at stake for particularly NFL teams or the professional franchises when they're trying to go ahead and take whatever edge they can get to go ahead and be competitive. And being a lifelong New England Patriot fan, I certainly understand what it takes to get a competitive advantage, whether it be letting a little air out of a football allegedly or taking a look at another team's practice. Teams are going to take a look at even things like this, the venues that people play in, and who's going to get to begin to practice first, whether they're going to open training camp a day or two early. Those small things that we may look at as really perhaps not involved, that's stuff that Rob and Kathy are going to have to be looking at in the NFL to make sure that while they're trying to maintain a safe environment and looking at a lot of the local geographic detail and data, while they're coming out with implementation challenges and protocols, they got to make sure they also don't create an unfair advantage somebody and just disadvantage someone else. I'm sure that's got to be top of mind for them as well.
Thank you very much, Jay. And I know one of the things that Rob and I discussed a few weeks back is that gaming integrity is an extremely important consideration in all of this. But just in the interest of time, let's go ahead and move on to our next topic of contingency planning. And Rob, a little bit earlier, had mentioned how there could be fallacies in the plan that you have. And so that's a contingency you might need to account for. Another one could be unproven technology. And so I just wanted to, we'll start with Jay on this one, but are you thinking of COVID operating plans in terms of different likely scenarios, such as in this location we have community transmission versus in this other location we have no community transmission? Are you thinking in terms of backup plans if, say, something goes wrong? Or are you thinking it with some other sort of framework? And Jay, could you please start on this one?
Yeah, no, happy to. And I think that's a key challenge that I think a lot of businesses and as well as government entities are having right now, is because, as I spoke of in one of the earlier questions, you know, this has been so nationally impacting and globally impacting. What we would see oftentimes in government, and we also saw this in a lot of businesses, you have the ability for continuity of operations, continuity of governments, and to be able to shift some functions to another geographic part of the country that perhaps a part of that business, to be able to continue to run, whether it be an ops center, whether it be a cyber center, or even some level of sales or manufacturing. This has been so broadly impacting to companies and countries. The ability to shift operations to other parts of the world has been more challenging than it would have otherwise, because oftentimes in any kind of contingency plan, where do I go ahead and shift some of my operations and leadership and executive decision-making and operations? That has been so impacted because most parts of this country and many places around the world have all been impacted as well. So I think that's going to be one of the key things that companies are going to have to take a look at going forward to rethink how do they do that. Because I know that many of them actually have had, you know, operation centers that kind of follow the sun so they can have 24 operations. But again, this exercise we did for a very large, you know, Fortune 20 company, they're trying to see what's actually impacting at some of their different ops centers around the world and where it would travel next to be able to make sure that they actually had personnel that wouldn't be impacted there so they could, again, sustain and continue operations. Because again, most times an event is so geographically specific. The World Trade Center bombing, hurricanes in Florida, earthquakes in California. Those impacted zones are very isolated. So you can continue to shift operations from outside of those impacted zones to other parts of an operation or a country. This has been so broadly spread. I think that has been one of the biggest challenges, that as people go back to the planning table to start to take a look at this, they're going to have to consider that now going forward, because I don't think in any of the planning that we've done in our past, and certainly have reviewed for companies in recent time, that they really had thoughtful consideration given whether, if all things were taken out, how would I go ahead and continue to deal with this going forward? And the last point I would make is the exercising. Rob made a point earlier that the probability of events like this happening, they're not necessarily funded, and therefore they're not necessarily something that's really into central part of a plan, but also therefore it's not exercised. So it's new to executives, the C-suite, the board. They're not necessarily, you know, really aware and thinking about how to deal with something like this going forward. Much like it was with cyber probably 8 or 10 years ago, a lot of the boards and C-suite were not thinking and focusing on the cyber attack as much of a threat as it is today. This is going to be one that's going to be front and center on the list of risks that have to be planned against and exercised going forward. And I think that's going to be one of the significant things going forward.
Jay, thank you very much for that response. And just one of the things that you touched on there was sort of the novelty of this situation, where maybe there was a plan for a pandemic, maybe not, but certainly not for this sort of global, highly infectious disease where there's some big stigma attached with it, but there's also the very real health risks and no cure right now. So Rob, what about you? How are you thinking about contingency planning?
I'm glad you asked, because this has been a question I've been, I guess, answering a lot over these past couple of weeks. I think, in all honesty, this shows the importance of your global operations center and the importance of having 360 planning. So, for instance, if you look at when we're talking about COVID-19, there's likely to be another pandemic, another virus, and we've already seen it in the past, right? So this, emphasizes the importance of health intelligence, which, even I will, say that, I did not follow as intently as, say, counterterrorism or cyber intelligence, what have you. But I think what this has shown is that, every dynamic is or every environment is super dynamic these days. So as we're dealing with COVID-19, we're going to hurricane season. There could be a terror attack that happens tomorrow. There could be a massive cyber attack that shuts down a state's or city's infrastructure. So I feel like what is happening now is for the survivability of businesses. They're going to have some type of entity that allows them to look strategically, both domestically and globally, on emerging trends, on threats, and recognize the fact that, I think in the past, whenever we had events, we kind of like over-indexed on things that were going on. So, for instance, when cyber became a big issue, we rushed to that. 9/11, pushed the emphasis of following counterterrorism and then screening at facilities. I think we're at a junction now where you have to kind of treat it, and apologize for the really old analogy, but very similar to that old school Simon Says game. And if you guys remember that on the call, you had all these colors that light up, and you had to press them. And sometimes you have multiple colors that light up, and you had to follow that path. You have to have an agile capability to be able to address those and to be able to quickly get that information to your C-suite so they can start, testing those business processes and thinking about their plan. And it can't just be a one-off plan like, oh, we're just going to make this decision. You really have to think about the second and third order effects and think like, hey, if we go with this plan, here are some of the branches and sequels to that plan. And do we have a strategy in place in order to be able to execute that? Can we sustain that? Going back to the serious model, are those things that are repeatable? And if you're not thinking in that vein, we're constantly find ourselves in the same boat when we're caught off guard. We don't have the money put aside for anything. We don't have the personnel who are properly trained to be able to address that as an organization. I will say, a lot of businesses, found themselves overwhelmed because they didn't have the expertise in-house. I'm not an infectious disease expert. And I will say a majority of the folks in the league are not either. But when something like this occurs, everyone inside your organization needs to understand their role and understand their piece of the pie, recognizing that, then, the C-suite can get the expertise and the right folks in the room to fill some of the gaps that you may or may not have. But I would say the same energy we're going to put in addressing COVID and health-related issues from this point forward, we can't forget about everything else, because everything else is still in play.
Thank you very much for that, Rob, and for connecting it back to the serious model that you discussed earlier. We'll go ahead and skip the second polling question in the interest of time. And you guys have both talked a little bit about communication. So let me narrow this question down a little bit, or this topic down a little bit. So Rob, you've mentioned in our conversations prior and then on this broadcast, how the security operations team has been not necessarily infectious disease experts, but they've had to become pretty quick studies on the risk. And I'd like to direct this question to Jay first. But if you're a security personnel or member of security team who has all of a sudden taken on this important responsibility of advising the C-suite on the risk of COVID-19 and risk to employees, perhaps risk to customers, what type of advice or guidance would you give to that security person?
Well, I'll tell you, one of the first things would be is not one always to be looking for direction, but I think in something like this, the board and the C-suite need to be providing a lot of the prioritization to the security component and the operational component, because my belief is in circumstances like this, and Rob touched a little bit about this on a couple of different questions, is that something like this hadn't been fully funded. And guess what? It's going to be a hard time being funded going forward, because many businesses are really suffering significant financial losses, going out of business. And they've been able to go ahead and stay afloat to some degree, oftentimes by good pivoting from a business standpoint, but also through the stimulus funds, huge amounts of stimulus funds that have been put out by the federal government, and then even down to individuals through some of the private monies that was public money given to private individuals. Money's going to dry out pretty soon. So I think this is going to be one of the critical things for corporate leaders to be able to figure out, what are the priorities here? What do I need to fund? And take a look at kind of, again, that risk, probability, and consequences equation to find out what are the most impactful things that can really impact my business most severely. I think this is going to change its position and really go high up on the list. What's that going to mean for cyber strategy? What's that going to mean for active shooter? What's it going to mean for physical security, access controls? And by the way, access controls are going to need to be adjusted to more contactless type of accesses to facilities and to even sports venues, I would imagine. But I think that's going to have to be something that's really going to be considered amongst the board and the C-suite, particularly if they're publicly traded and reports to shareholders that are required, because these are going to be critical decisions that companies need to take a look at. But what are the priorities? How do we fund those? And also be bold enough to go ahead and say, we're not going to be able to do other things because there's, again, not limitless amounts of money. So those are going to be some of the challenging things that I think that a lot of the executives are going to need to provide to people like Rob, people like, the Kathleen Laniers of the world, people that actually run cybersecurity, physical security, and the security components through a lot of different risk components within an organization. And then the security professional or the advisors can then go ahead and provide the recommended source of attack going forward. That's just certainly what I'm hearing and seeing from a lot of the different companies we're advising now, because it's been a little bit of a shift and it really has come down to the impact of available funds to do some of these things.
Thank you very much for sharing that, Jay. And Rob, I'm wondering what your experience has been, if people have been giving you any guidance, perhaps Chief Lanier, or if you're giving yourself guidance or pep talks in the morning, or what you're telling your team on a daily basis about navigating these challenges.
I think oddly enough, or maybe not so oddly enough, the GSOC model or the GSOC operation is something new to the league. And I think prior to this, I know Kathy had done a lot of work fighting for our existence. This pandemic, the protests, and a host of other things have more than emphasized the importance of why we exist and how we, kind of become, in some ways, one of the heartbeats of the league. Because at the end of the day, for everything that you're trying to do, public trust is key, and even more key now with the spotlight of the coronavirus stuff. So your ability to execute strategies that protect your employee are equally as important as protecting your consumers who are coming into your spaces. And to echo Jay, it does get complicated because at the end of the day, if you can't execute your primary business function, which drives revenue, you really have to start looking inside your coffers and saying, hey, where am I going to actually make this spend? I would say for sustainability purposes, your spend is going to have to go to your security side because even if you're able to open back up and get back running business as usual, the landscape has changed entirely now. So from like a brand reputational thing, I can't imagine a situation in which, say the league, you ignored, all the CDC guidance and regulations and stuff, we would be out of business, pretty shortly because we would be looked at unfavorably. and not really being in touch with the current considerations. And say if your employees, as your employees are returning to work, if not instituting safe measures and really keeping those employees in mind and their safety foremost at heart, then you're going to find yourself in an equal reputational issue. So you have to really start thinking, I think, a little bit more broadly about how your security element plays into that and how they protect you both on the physical and cyber side from ruining your public trust, and help informing you on the strategy to take to be able to fulfill both your obligations. But it's a challenge. It is most certainly a challenge. And then oftentimes I think, it's a hard sell because I know some of the arguments that we get on our side is like, well, security doesn't generate revenue. That is true, but we can protect it.
That's a really good point. And one of the things I've heard other security teams doing is quantifying to the extent to which they protect revenue. I think that'll need to be a topic for a different broadcast. We do need to get to our last polling question here before we jump into the audience question and answer session. And that question is, would you like to learn more about advisory services from the Chertoff Group or COVID data and decision-making tools from Topo.ai? And you've seen some examples and heard some examples of that on the broadcast. Please select only one option. So select A if you'd like to hear more from the Chertoff Group. Select B if you'd like to hear more from Topo.ai. And select C if you'd like to hear more from both organizations. And we'll leave that up for just a moment. And we will not share these results with the audience, by the way. We'll leave that up for just a moment, and then we'll get right into the questions and answers. We've received a lot of really good ones during this broadcast. Okay, everyone, thanks very much for participating there. Let's move on to the question and answer session here. We got one question that came in early in the broadcast. What are the panel's thoughts relative to COVID-19 testing and antibody testing, and how this information might be utilized to help society or perhaps employees feel more comfortable with being out in public or in public venues? Sorry, let's start with Jay on that one.
Yeah, I think depending on which test you're actually going to be talking about, a lot of the testing is perhaps a little bit of a false sense of security to one degree or another, because it means at that particular point in time you are not, positive for COVID-19. The antibody testing is perhaps a little bit differently, but until there's an actual vaccine, a lot of this is just going to be point in time calming of the workforce or of the public at the particular time the test was positive. I actually live down in South Florida, so we've seen the numbers surging here, and there's just lines of vehicles around Hard Rock Stadium just going in to get testing. A lot of those individuals are not symptomatic whatsoever, but they're doing it for peace of mind as opposed to really trying to go ahead and really make a positive impact. And it's creating a real backlog into hospitals, point of testing that occurs in doctors' offices and other places. So I think that the testing is really something that is also driven the numbers up extremely high for individuals. But I think there's a lot of different opinions that the medical professionals that I've heard, and this is really one for medical professionals and perhaps risk or security professionals like Rob or I to answer, because I listen a lot to, the Dr. Rauschis of the world and Dr. Redfield from the CDC and Dr. Birch from the Coronavirus Task Force give opinion, and there's a lot of different responses that come frequently on it. So I don't think there's a lot of consensus on the opinion on some of these things. So I just think until we actually do have a vaccine, a lot of the testing will perhaps not be as important. And again, that's a personal opinion that's not based on any medical expertise whatsoever.
Thanks, Jay, and thanks also for that qualifier. Rob, what's your perspective on this matter with respect to testing and maybe in particular antibody testing?
I would echo a lot of Jay's sentiment. I think there's still a lot that's unknown, particularly with the antibody testing. I think one of the gaps in information right now is whether or not if someone does have the antibodies, how long that lasts, and if that has an impact, whether or not there's a mutation in a strain that, say, comes in the quote unquote second wave. I think testing protocols and having availability of services does help with both employee and consumer confidence, but there's still so much as far in regards to variables and so many unknowns. So I would be hesitant to give folks a false sense of security, similar to what Jay said, just because we don't know the long game just yet. Those are great data points, but I would not base your entirety of your strategy on those factors.
You know, Andrew, if I could throw one other point in as well. I mean, when you take a look, even what many hospitals are doing on this, and I can speak to firsthand experiences. My wife is a director of nursing at a hospital here in Florida. They have made a conscious decision not to go ahead and test the workforce, while other hospitals have, and because they take a thought through the whole continuum of impact. You know, the impact would be if all of a sudden a lot of individuals started testing positive, they immediately have to kick into that 2-week period. And what's it going to mean for the availability of workforce? And again, keep in mind that that's not people that are symptomatic at that point. So there may not be any immediate risk to health. They could certainly be symptomatic and be fine and not get to any severe case. You flip that on its head, what other medical facilities doing, they want to know that as early as possible, so you can go ahead and engage earlier in that process to perhaps treat, mitigate further impact, and perhaps even save a life. So there's a lot of drama back and forth on some of these things, which is why, again, I'd kick this to the medical professionals to give the best advice to a lot of the companies on this call.
Thank you for sharing that personal experience and perspective there. And we have come to the top of the hour. Do either one of you have any closing thoughts on this discussion or any kind of parting words of advice? Rob, let's go with you first.
I would say, a couple of things. One, I think you have to recognize as a community that none of us have been in this environment before. We're asking a lot from folks who don't come in with a pandemic experience, and that a lot of your decision points are going to be tough, and they're going to be, multifaceted. But I think we have a community of very smart individuals, both on this call and at large. So I would say lean on each other and learn what each other's doing. And I think if we work together, we can actually get through this. Understanding we all have different, equities and commodities are at play, but kind of the expectations are the same. To keep employees and consumers safe the best that we can, while maintaining business continuity. So with that, I'm always available. Please feel free to reach out, and really am thankful for Andrew for putting this together.
It's my pleasure, and thank you for presenting that offer to the audience. Jay, do you have any closing words or any parting advice?
Yeah, a couple of real quick things. Again, we're in this for the long run. The long run may be through the end of this summer, into the fall, in the end of this calendar year or the first quarter of next year. So I think that's things that people need to realize. This isn't going to pass quickly. I think some of the early forecasts, that might have been a lull over the summer where a lot of companies and entities could kind of clear their heads, redo their plans, re-up their supplies and be ready for a resurgence in the fall. It doesn't seem like that's the case in many parts of the country right now. So I think this is sustained now through the summer and into the fall until there's a virus. But I think one of the biggest pieces of advice that I would certainly offer to everyone and remind ourselves of is, and I'll borrow one of the S's from Rob's SIRIUS acronym, and that's sustainability. You go back over the tragic events this country has faced in other areas, and why companies really didn't look, and governments didn't look too heavily at pandemic as a highly probable risk with the type of consequences we're seeing today. They put it low on the totem pole. Now, all of a sudden, human nature is going to put it right to the top of the risk profile and say, we got to make sure that we're never going to be unprepared for this again in the future. Like someone taking 2 airplanes and driving them into the World Trade Center and a third one into the Pentagon. Probability of that happening going back years ago was very, very low, but the consequences have been high. The government immediately pivoted to putting a new architecture in for government, created the Department of Homeland Security, a transportation security agency, a new border agency, and invested significant amounts in resources and technology And as time has passed, the discipline to sustain the focus wanes. And I think that with a pandemic like this, memories are short, and people are going to forget the significant consequences it had on the economy, on the health and welfare of the public, and figure, well, the likelihood of this happening again won't happen 3, 5, 7 years from now. I think that's the biggest concern that I think many individuals and companies should have, and governments, to make sure that they have the plans to be able to pivot to this in the future going forward. Because again, memories are short. We've seen it with 9/11 and other major catastrophes in this country.
That's very kind of gripping advice, and I thank you for sharing that. And it just reminds me what I've heard some other security professionals say about not losing sight of the other risks. And you both have covered it as well on the broadcast. You know, the other hazards that present themselves to businesses and people. Well, anyway, we reached the end of our broadcast. We thank the audience for joining us and for sending in questions. And a special thanks to Jay Ahern from the Chertoff Group and Rob Gummer from the NFL for sharing their insights and for working tirelessly to keep people safe, making careers out of keeping people safe. We're going to share a link to the recording and the presentation materials later this week. And on behalf of the panelists and also my colleagues at Topo.ai, we wish everyone good health and good luck navigating this pandemic. Everyone have a nice day.